We're studying how flu enters Seattle, how it spreads among different populations like kids and adults and people in hospitals, and then developing different ways to stop its spread. What we found was that there was a lot of flu, and that flu was actually present in the community a couple of weeks before we saw it in the hospital. So if you were to do community-based sampling, so looking in the community for flu, you actually see it 2 to 3 weeks before it arrives in the hospital, which really helps for sort of preparedness for when flu season hits. Some of the things that we are doing this year are we'll be doing some sampling of the air and surfaces in places around the city to see if there's a role of airborne transmission of flu and spreading it in the community. And then also we'll be doing some studies in school-age children to understand how much of a role they play. We know that from many studies in the United States over the past 50 to 60 years that children are really sort of the canaries in the coal mine. They're the first ones to get sick. They're sort of the harbingers of the flu epidemic in the community, and that schools and daycares and places where children congregate are really the places where a lot of these viruses are transmitted. They are smaller and younger, and their immune systems are younger, so they haven't seen flu as much before. So when they get sick, they get more sick, and they have more virus. So when they cough, more virus transmits to the next person. So flu is hard to predict. It mutates very quickly. We think that it's going to be a bad season. And the reason we think that is because we often look to Australia, and Australia is having a very bad season right now. They peaked their flu very, very early, and they still have flu, so they have the longest flu season that they have ever seen. I think what people are hoping is that very soon we'll have a vaccine that targets the part of flu that doesn't mutate, so a universal flu vaccine, and the idea is that you would get this vaccine just once and it would protect you year after year. And that's really the ultimate goal. Until we get to that point, I think you need to get your flu shot. We know that when you get the vaccine, it boosts your antibody, and antibody is really important in protecting you against getting severe flu, and particularly against it keeps you out of the hospital, it keeps you from getting flu that's bad enough to send you to the hospital. So that even if the vaccine is not a great match, you still have protection to a degree, so that makes you not get as sick as if you didn't get the vaccine. For the last couple of years, the ACIP has said that the flu mist has not been as effective and have recommended getting the flu shot. For this year, they changed their recommendations so that both are equally recommended. You can get flu mist or the flu shot.